Hello my dear friends, welcome to Nurses Voice channel. আমরা অলরেডি কমিউনিটি অ্যান্ড চাইল্ড হেলথ নার্সিংয়ের উপর অ্যাপ্লাইড কোয়েশ্চেন অ্যান্সার দেখে নিয়েছি। আজ আমরা মেডিকেল সার্জিক্যাল নার্সিংয়ের উপর মডেল 3 কোয়েশ্চেন্স দেখে নেব। এখন সমস্ত নার্সিং অফিসার এন্ট্রান্স এক্সামে থিওরি বেসিস কোয়েশ্চেনের পাশাপাশি অ্যাপ্লাইড কোয়েশ্চেন অ্যান্সারের উপর বেশি জোর দেওয়া হচ্ছে। তাই বন্ধুরা অ্যাপ্লাইড কোয়েশ্চেন অ্যান্সার প্র্যাকটিস করতে থাকো এবং এখনও পর্যন্ত যারা আমাদের চ্যানেলকে সাবস্ক্রাইব করোনি তারা এখনই চ্যানেলকে সাবস্ক্রাইব করে বেল বাটন দিয়ে দিও এবং সমস্ত মডেল কোয়েশ্চেনগুলি প্র্যাকটিস করতে থাকো। আজকের ফার্স্ট কোয়েশ্চেন হলো, এ 35-year-old male patient complain of abdominal discomfort and bloating. On examination, the nurse found leakage of watery stool from his rectum. The nurse is aware that this could be a possible sign of intussusception, bowel incontinence, fecal impaction, or option D, constipation. And here the right answer is option C, fecal impaction. Fecal impaction is a severe bowel condition in which a hard dry mass of stool gets stuck in the colon or rectum. Fecal impaction can be serious. Fecal impaction can cause a range of symptoms which include liquid stool leaking from the rectum, pain or discomfort in the abdomen, nausea or vomiting, abdominal bloating and feeling of a need to push. Next question. Nurse Megha is preparing a 45-year-old male client for gastrectomy surgery. The patient apprehensively asked the nurse about the possible complication of gastrectomy. Which of the following responses by the nurse is appropriate? Dumping syndrome, clay-colored stool, ribbon-like stool, or option D, jaundice. And here the right answer is option A, dumping syndrome. In dumping syndrome, the stomach empties its contents into the small intestine or duodenum faster than normal. Dumping syndrome is also known as rapid gastric emptying. The sudden influx of food into the intestine causes a lot of fluid to move from bloodstream into intestine. This extra fluid causes diarrhea and bloating. Next question. Miss Sita, 27-year-old, has fever and pain in the right upper quadrant that increases on eating, fatty food and anorexia. She is recently diagnosed with cholelithiasis on abdominal ultrasound. The nurse explained to the patient food which she should avoid taking is potato, rice, bread or cheese. And here the right answer is option D, cheese. The patient with cholelithiasis are advised not to take food with high fat content such as dairy products like butter, cheese and ghee, and should avoid fried foods because these fatty foods will further worsen the condition and result in severe pain to the patient. Other listed food items are appropriate for the client to consume. Miss Rajni, 30-year-old female, suffered with deep partial thickness burn on the front and back of both legs and anterior trunk. Calculate the burn area using the rule of 9. Option A, 27%, option B, 36%, option C, 45% or option D, 54%. And here the right answer is option D, 54%, because in the given patient the burns had occurred over the front and back of the both legs. According to the rule of 9, each complete leg occupies 18%. Hence for the both legs it should be 36 and for the anterior trunk it covers 18%. Hence the total burn area would be 36 plus 18 is equal to 54%. Next question. Which type of fluid should the nurse expect to prepare and administer as fluid resuscitation during the emerging phase of burn recovery? Colloid, crystalloid, fresh frozen plasma or packed red blood cell? And here the right answer is option B, crystalloid. The person undergone burn injury needs a priority action of fluid resuscitation rather than providing blood products. Hence, the crystalloids such as ringalactate and NAs should be administered for fluid resuscitation, and the blood products like colloid are not the appropriate for the fluid management. The weight of Miss Rajni is 63 kg. Using the Parkline formula, the nurse calculates the total amount of ringalactate that will be given over the next 24 hours is 13,608 ml, 12,200 ml, 8,625 ml or 6,789 ml. And here the right answer is option A, 13,608 ml. Here, the client's weight is 63 kg. Therefore, according to the Parkline formula, 4 ml should be multiplied with the percentage of burnt surface area, BSA. And the weight of the client, here the calculated BSA is 54% and the weight is 63 kg. Therefore, it would be 4 into 54 into 63 is equal to 13,608 ml. Fluid should be administered over the next 24 hours. Out of this, half of the fluid needs to be administered in the first 8 hours and remaining half in the next 16 hours. Next question. A 42-year-old woman with cancer of breast undergoing mastectomy. A Jackson Craig drain is placed to help empty excess fluid from the wound side. The nurse is aware that the Jackson Craig drain is usually removed when the 24 hours drainage volume is equal to or less than 20 ml, 30 ml, 50 ml or 60 ml. And here the right answer is option B, 30 ml. How long the Jackson Craig drain has to be inserted depends on the surgery and the amount of drainage. The Jackson Craig drain is usually removed when the drainage is 30 ml or less than 24 hours. Next question. Nurse Deepa, a palliative care nurse, is providing nursing care to a terminally ill patient during the dying and grieving process. She is aware that the least important goal of nursing intervention in this client is providing comfort measure, promotion of rest and sleep, increased self-esteem through the cosmetic improvement, or option D, pain management. And here the right answer is option C, increase self-esteem through the cosmetic improvement. The nursing intervention should target pain management through pain reduction technique and analgesia, providing comfort measures, promotion of sleep and rest, and energy conservation for this patient. Though dying with dignity and self-esteem is important, increase of self-esteem through cosmetic improvement is not the important for this client. Next question. A 42-year-old woman is recovering from mastectomy. The patient has to be positioned to promote the lymphatic fluid return. Which of the following position is inappropriate to promote lymphatic fluid return? Semi-Fowler's position, placing the affected arm on the pillow, side-lying position on the unaffected side, or option D, turn the patient on the prone position on the affected side every 2 hours. And here the right answer is option C, side-lying position on the unaffected side. Semi-Fowler position, head of the back 30 degree, with the affected arm placed on the pillow promotes lymphatic fluid return. Side-lying position on the unaffected side will not promote the lymphatic fluid return. So here the right answer is option C, side-lying position on the unaffected side. And the last question, a nurse is providing health education to a patient receiving external beam radiation. Which of the following is not included in the health teaching? Protect the skin from direct sunlight, chlorine and extreme temperature, shave with an electric razor only, apply good scented cream to moisturize the skin, or wear loose fitting clothes. And here the right answer is option C, apply good scented cream to moisturize the skin. After external radiation therapy, patients are not allowed to have direct contact with UV light and to use any creams or lotion or liquid over their skin. Hence, the nurse should not educate applying of any manual cream over their skin. Other statements are appropriate for teaching this client. তো বন্ধুরা, এই ছিল আমাদের আজকের ভিডিও। পরবর্তী ভিডিও আমরা মেডিকেল সার্জিক্যাল নার্সিংয়ের উপরেই অ্যাপ্লাইড কোয়েশ্চেন অ্যান্সার দেখব এবং ভিডিও ভালো লাগলে অবশ্যই লাইক করবেন। অ্যান্ড থ্যাংক ইউ ফর ওয়াচিং দিস ভিডিও।